it going. Hi, happy Friday. This is Dr. Huguet, and today we're going to be reviewing the what's known as the Setpoint Theory in bariatric patients. So I hope you all having a good Friday out there, and I'll be open to any questions regarding the Setpoint Theory. That's our topic for discussion today. So I'll just start kind of reviewing the concept of set point, and if anybody has questions, please feel free to chime in. Your set point is what we think of as kind of your body's point of homeostasis. It thinks where its weight should be. There's several factors involved with what creates a set point, but it's a very simplistic way of saying that it's your body's comfort zone in that at that certain weight. So the way we think of it is as you age and your metabolism slows down, your set point can go up. And so the reason that's important is that generally, surgery is the only way, in my opinion, to really alter that set point over the long term. And it does it by making a physiologic change to your body. And so the reason that's important is, say you have a set point, and the set point meaning a certain weight that your body likes to remain at. And say your set point is, for example, 300 pounds, and that's your set point for in your adult life where your weight sits, and that you can kind of yo-yo around it, which is what frequently happens, where you'll lose some weight, maybe 20, 30 pounds, and then generally you'll regain the weight and then go over that set point and then maybe come back down and fluctuate. But on average, it's about that weight. If you were to go on a very intense medical weight loss program, for example, and say we did really well and lost, say, 60, 70 pounds, and say instead of 300 pounds, now we're down at, say, 230 pounds. Well, your body at that point really does not change the set point. So your body at that point knows that it really liked that 300-pound set point. And so it oftentimes it's hard for your body to give into to keep that new weight, and it often gives in to urges. And 95% of the time you will give in and regain the weight and go back up to that set point. The reason surgery is important is that it actually lowers that set point to a new weight. It does it by changing the anatomy or the physiology of your body, which then involves hormonal changes. And by doing that, it brings your set point from, say, 300 pounds down to, say, 210 pounds, or whatever, based on your height, we'd have to figure out your new set point. And that's why surgery is generally so much more effective in long-term weight loss than medical weight loss, in my opinion. It alters the anatomy, and then therefore you're less battling with your body and its own genetics to keep the weight off. So it one of the things surrounding that is your appetite. And with surgery, frequently your appetite will drop, and that's another way that it works. It's not the same as if you lost the weight on your own and then you're hungry the whole time. With this, with bariatric surgery, particularly the laparoscopic sleeve gastrectomy, you lose the weight, but you're also not hungry. So that's another way that it works really well. So do we have a question here?
We have a comment from Debbie. She said, "This losing weight before surgery is a killer."
Okay. That's because you're.
Hardest part.
Debbie has said losing weight before surgery is a killer. Well, it can be difficult, and that's because you don't have the benefit of surgery to alter your set point. And so that would be not unexpected, just like losing weight for any other reason if you haven't had the benefit of surgery. Because surgery is a very nice tool to help with that set point change, and without that, it makes weight loss definitely more challenging in the long run, which studies have shown around 95% of the time, without surgery, patients will regain the weight that they lose from any other kind of a weight loss program outside of surgery.
And so Debbie said, before surgery, how do you go lower than your set point? So is there a way to go lower before surgery?
So your set point is kind of where your comfortable weight is, for example, And so when you lose weight, you will go below your set point, but you really don't alter that set point prior to surgery. And surgery is one of the only things that can actually lower that set point. Um, so you would go below it by weight loss, but you wouldn't necessarily alter it without having surgery. And it's what causes it is it's it's something that we have created as a concept. Uh, to pin down exactly why somebody has a certain set point, there's environmental factors, there's genetic factors, the behavioral factors. So there's a lot of things involved, so you can't say there's just one thing that helps create this set point.
Before the 2-week liquid diet, how important is it to lose weight?
So weight loss only helps with surgery, and the question is, so we start a 2-week liquid diet prior to weight loss surgery. And so the question is, well, how important is it that I lose weight before I start that 2-week liquid diet? And it from a patient's perspective, it is very helpful because it makes the surgery much safer. Because any weight loss you do before surgery will help shrink your liver, which is the purpose of the liquid diet for 2 weeks. Because with obesity, there's an enlarged liver, and so anything we can do to shrink that liver in addition to the 2 weeks worth of liquid diet is always going to be helpful. And then on top of that, you hit the ground running with more weight loss, and so it's additive to lose that much more weight when you take your whole weight loss in the picture after, let's say, a year or so.
Alright, see if we have any other questions coming in.
There we go. Let me see another question. So, how does weight loss surgery change your set point? And I don't know that we know the exact physiologic mechanism. There are some hormonal changes that occur. There's a hormone called ghrelin, and that we know that hormone level does drop after weight loss surgery. And so that's one of the many pieces of the puzzle. But there's several factors involved in the difference in physiology. And so I think in time we might be able to come up with some more reasons, but for now that's what we've got.
Mariah says, I had questions but went blank. I said, well, give us a call or send us an email.
Okay.
Darla says, hi.
Hi, Darla. All right, well, I guess we can wrap that up for today. I hope you guys have a nice Friday and enjoy your weekend and stay safe out there.